Hello, it's my pleasure today to introduce you to Professor Charles Musselwhite, Head of Psychology at Aberystwyth University. Charles has extensive experience, research and practice experience in looking into driving issues with older adults and people living with dementia. So, morning, Charles.
Hi.
So basically, what we're going to look at today really is about the practicalities once somebody's had a diagnosis of dementia. Now, I know when I worked in the memory clinic, one of the most difficult conversations that we had was around the issue of driving because of its link to people's independence, really. And I'd sort of like to know really, we know that people don't have to necessarily give up driving straight away. But due to the progressive nature of dementia, we know there will come a time. So, Charles, is there a process that, if we're advising or supporting a family, is there a process around this?
Yeah, so with a diagnosis of dementia, then you should inform the DVLA straight away. And there's like £1,000 fine if you don't. It doesn't mean, as you say, Jane, that you'll have your license taken away or you immediately lose the ability to drive on that diagnosis. It might be the case for some people, but hopefully in those really extreme cases, the doctor will advise that anyway. That's a role of a healthcare practitioner if it's really severe, particularly around attentional, memory, eyesight type issues that might be associated with the dementia. But normally a diagnosis wouldn't mean that you have to give up driving. What will happen is you inform the DVLA and they want to know a little bit about the condition and how you've been diagnosed and some of the issues on the diagnosis. And then the healthcare practitioner might be involved in that conversation as well. So sometimes the DVLA will write to the healthcare person who's looking after the case, not always, to get a bit more information. And then the DVLA, you don't have to give up driving immediately, but they might write to you and ask you to do an assessment of some kind. It may be a more formal driving assessment that you do at a driving mobility centre, for example, and you'll get given a time and a date to go and do that. And again, normally at those, only extreme situations would you have your keys taken away from you there and then. It's more they would give you some practical advice about anything they felt that you weren't doing very well. They might also offer some training to help you get better. And they might, in the longer term, ask you to come back again, say in 6 months or so, because we all know, dementia progresses really differently, or the symptoms progress really differently in different people at different rates, which makes it really complex. It may be that you don't have to do well. The person with the diagnosis doesn't have to do anything in terms of practical driving assessment. So then we would still really recommend that they ought to go and perhaps have their driving looked at, perhaps by a driving instructor or even just a family member, just to make sure that they're okay. I mean, it's a good chance to start the conversation about potentially giving up driving, having a diagnosis in the first place. Not that you'd have to do it immediately, but we all know that those people who give up driving a lot better, the research, as bears this out time and time again, with less impact on their health and their well-being, are those that plan well in advance. So if you can start supporting somebody to go through the process of giving up driving by suggesting they have their driving assessed by a driving instructor or by family members, then that can really soften the blow that might have to happen to loads of older people with dementia or not in the long term. So start talking about that issue. We know healthcare professionals don't like talking about the driving issue because it relates very much to people's health and well-being. But at the same time, we do know that older people quite like a healthcare professional to mention it or to note it. I was talking to you beforehand, wasn't I, Jane, about the DVLA, sort of driver vehicle licensing authority, has a 140-page booklet for healthcare professionals now about suggesting, that that very grey area between when somebody can continue to drive or whether they shouldn't, and in what circumstances, and the role of the healthcare professional in that. And I'm really not sure there's any great answers to it, other than perhaps just being very honest about it, saying, I can't assess your driving for you, but it's a good idea if you go and get it assessed if you're anxious about it, because we know that driving instructors will do it for a small fee. There's the driver assessment centres, and they're not there to take your keys away. They're there to help you support you on the road for longer. But again, it is quite a good start of the conversation to think about alternatives.
And it is difficult sometimes. I know when I was working in the memory clinic years ago, I was supporting people where, often the husband would be the driver, and sometimes the spouse didn't drive. And so the spouse, who now might be a carer, may be reluctant to be open
Yeah.
and honest because of it impacts on their independence as well. So it's a huge family issue, isn't it? And especially if you're rural. So do you have any suggestions about how the person, once we can perhaps help support them to give up driving, how they can maintain independence when they do have to stop driving?
Yeah, well, first and foremost, that we again in the research would suggest, and you're right. I mean, even the last examples you've given, it is such a huge sort of social issue. So it's got emotional elements to it. It isn't just a practical thing. You're not just substituting driving and then you get on a bus and do your journeys instead, if you're lucky enough to have a bus to be able to do that. So we know it's hugely emotional issue. It has all those other elements of potentially sparking problems within families or bringing out the tension within families. And again, as healthcare practitioners, we'll see that perhaps sometimes in the room, the anxiety around giving up driving. I mean, there are examples. It's rarer than you think, but there are examples where people hide their or mask their symptoms because they're worried about the driving element. It does happen. It's rare. It tends to be men more than women still in this day and age. Much more wedded to their cars, much more about their role and their status and who they are. So it's worth having the conversation and bringing it out again, that getting families to think about that, because that's how if you're going through the process of giving up driving as an older person, you want the support of family and friends around you to be able to do that. If you're lucky enough to be able to have the social connections around that, because they can offer emotional support, they can offer practical support. But there are some examples again in some places, and we're trying to grow these a little bit where they happen, where there's community groups that support one another a little bit in it. Age UK, Age Concern used to be really good at Age UK. Sometimes pick up or at least facilitate these groups in certain areas where there might be a buddying system for people. So if you haven't used a bus since you were like 16 or 17, like can be the case for many people, you don't know how buses operate or how they work these days. So a buddying system can really help and adds that social element. So you travel with an expert who uses it daily. There's also, transport groups that they'll talk about the transport issues in their community, because as soon as you don't have a car, you haven't got that sort of day-to-day vehicle that you can just use when and where you want to. You rely on either other people or buses or on taxis, but there could be problems with that. So there's some really good lobbying groups. Some of the some examples of that in Greater Manchester and some cities, but there's also some rural examples, because like you said, rural areas particularly difficult with public transport. And sometimes community transport can pick it up really well. I think we're trying to get away from the image that community transport is for really old, frail, doddery people, and that it's a bit more trendy and cool these days. So, it isn't just a dirty, scrubby old minibus, but it's an electric limousine, if you like, that takes people for days out. And there's some brilliant examples again, but what happens in the UK, is typical that some areas just do it much better than others. I think if you go to Pembrokeshire and retire there in the countryside, whether you move there or you live there, there's some really brilliant community transport provision there that you just don't find in other places across the UK. So, and it's often down to a few individuals who start these things up, and then having the support or the resource to keep them going is vital. But I think community transport is going to pick up more and more of that gap when public transport is no longer able to do that in many areas. So we've just got there's a bit of an image thing I think around that.
Mm,
So again, for a healthcare practitioner, if you just knew a little bit more about the provision that's in your local area, you could point people in the right direction of these kind of groups. So know what's going on in community transport wise, or know what's going on in the community in terms of groups that might support one another. As I say, I think most older people that we deal with have got some family and friends who do that, but it can't be guaranteed. So that's
no.
why the role of signposting, if you like, is to these organisation groups is really important.
Mm. Well, thanks, Charles. So it's good to know, though, that there are other options. I suppose as well, tips about, helping families approach someone who's really starting to get quite agitated about, maybe sometimes they'll hide their keys, or there'll be some, one of the bits of advice I suppose that we've always said is that we always reiterate that it's the doctor's decision at the end of the day. So we blame it on the doctor a bit, but that helps families sort of sometimes, patients will be more likely to listen to that. Also, driving has become quite stressful over the last few years, hasn't it? Cities are quite difficult to drive in, so we sort of give some advice around that, about that it's not necessarily about your driving capabilities, but it's about how you would cope when, we have bus lanes, you don't know where you're driving, there are cameras everywhere, the state of the roads, thinking of all these sort of almost like excuses really for families to help
Yeah, no,
plan.
I think you're absolutely right. All of that conversation is probably not even an excuse. They're all valid things for us all. I think as we age, driving's a funny thing. We do it almost without thinking. It's in every day you can drive, and you can't even remember what color the traffic lights were and what your journey was like. It's a very automated process, so we don't get the normal feedback that we get from other behaviors that we do. You can drive really badly and get away with it. You can drive really well and crash. But you can hedge your bets by being a better or poorer driver, of course. But it's not a perfect situation where you get the relevant feedback. And I think, and you're right, the environment within which we drive changes, and you've got to be able to adapt and change within all of that. And we know older drivers as a cohort don't necessarily have any more collisions than other age groups because they're able to adapt their driving, so they don't have to drive at difficult times. They don't have to turn right at that really difficult junction. They can, because they might be fortunate enough to have retired from work, they don't have to do those things, and they don't have to drive in poor weather and things. So if they did have to do those things, like they're encouraged to drive later, or that a situation arose and they had to do that, that's going to add extra pressure to their driving ability. And where they haven't done that for a long while, say, then their experience isn't there to deal with that kind of situation. So yeah, I think we all do driving day to day without thinking about it very much until an issue occurs, because we're just doing it. But if you get out of the practice of doing that, it can be even more dangerous, let alone changes. Again, these are changes that happen to us all as we age, but at different rates in different places. So your eyesight, your hearing, all those sensory issues, and attention and memory and things like that, we use them all the time in driving without thinking. It's only when they come to a head and they're an issue, and that by which time we hope that's not too late. So it is about blaming it on blaming it on the doctor, blaming it on the modern conditions, blaming it on how things have changed and got more busy and more difficult on the road, and how cars have changed and things like that. But just reminding them that although it feels like an ordinary everyday thing that we all do, it's really a difficult process full of skills that's particularly dangerous as well. It's probably the most dangerous activity we do, but we kind of like forget that. And that's probably not a good thing at any stage of life, let alone in later life.
Oh, that's wonderful, Charles. So basically, just to sort of reiterate, then, if we're supporting somebody, then they need to firstly register with the Driver Vehicle Licensing Authority.
Yep.
And obviously, hopefully the doctor, they will be working with their doctors in the memory clinic or GPs or
Yeah.
whoever. And then it's about whether it's deemed that they should have an assessment,
Yeah.
a driving assessment in one of these mobility centres. And then at some point they will have to give up. And so then it's about finding those reasons. Trying to reason with someone who has dementia can be difficult as their
Yeah.
dementia progresses. So that's always the difficult one. So again, looking at the changes that are happening in the driving world nowadays, and sort of trying to think of all those sort of reasons why the person shouldn't drive.
Yeah,
So,
and looking for pinch points, I think, is really important. I think that's what we've kind of called the more touchstone bits, where you know, if you've got a car that's got quite a few, or you've got a relative that's got quite, or you encourage somebody to identify whether they've got, you know, lots of bumps and dents on their car, then maybe that's a good precursor to stop driving. Or you've driven somewhere and there's been an incident that happened that didn't, hopefully didn't result in a crash, but nearly did, or something like that. Maybe sometimes people use those themselves when they've got good
mm,
insight, and that's enough. You know, I've had stories of older people tell me that's when they decided to hand the keys over, because they nearly crashed at a roundabout or somewhere, or they had a particularly difficult journey where they were, you know, people got frustrated with them, or somebody just pointed out to them, you know, every time you reverse out of that gate, you're bumping into the edge of the, you know, the edge of your gate post or something like that.
mm,
So it is trying to encourage people to have a bit more insight, but that's very difficult in an emotional situation where people's insight into driving is not great anyway, let alone how that might change with cognitive difficulties in later life. So, but if they can, that's brilliant, because we all know again that those who give up driving really well is when the locus of control is with that person themselves. So it
yeah,
comes from the person, and there's no reason why, you know, whether you've got dementia or not, you still shouldn't be able to own that decision a little bit. That's
yeah,
And that can happen with good conversation again
mm,
around the person. But you know, don't you think it's time to give up driving? Is really the what you're asking, but getting them to, you know, you finding bits of it difficult, and yeah, what do other people think of your driving is a good one always, if they're giving
mm,
people lifts and things like that. So yeah, you're right. Yeah, it's that those pinch points, touch points, are useful to discuss. But
and then
like I said, the difficulty is just because, you know, the prognosis, or the way dementia develops is so different in different people, that
mm,
you don't know whether you need, you know, that might happen immediately after a few weeks, or it might
yes,
happen
it
in
depends.
10 years time when the
Mm,
pinch points begin to become an issue. So it's that's the tricky bit.
and it's knowing when, isn't it? Yeah. So
Yeah.
that preparation is a good idea. What
Yeah.
we'll do at the end of this film, we'll put a link to the booklet,
Yeah.
and any, you know, if there are any other sort of links that we can see for local, again, find those other creative ways of alternatives
Yeah.
to driving.
Yeah.
Thank you very much, Dr.
Great,
Charles
thank you.
Musselwhite. Thank you. That's really helpful.